my name is Ayani Najida binti Izzuddin Elias Muhammad. My matrix number 24003009. So today our group 2 will be presenting about palliative care for patients with lymphoma. So without wasting any time, let's get into it. So, have you all been wondering what is lymphoma? Let me explain. Lymphoma is a type of cancer that begins in the lymphatic system, which is part of the body immune system. It occurs when the lymphocyte, which is a type of white blood cell, become abnormal, grow uncontrollably, and accumulate in lymph nodes or other organs such as spleen, bone marrow, or liver. So, for this abnormal growth can form tumor and interfere with the body ability to fight infection. So, there are two main types of lymphoma, which is Hodgkin lymphoma, which is characterized by the presence of red stem cell, and non-Hodgkin lymphoma, which is a larger and more diverse group of lymphoma. So, these common features of lymphoma include painless swelling of lymph node, fever, night sweat, and unexplained weight loss. So now we all know the lymphoma is mainly divided into two major types, which is based on how the abnormal lymphocyte look and behave. So now I will explain one by one about types of lymphoma. So for the first one is Hodgkin lymphoma, identified by the presence of red stem cell, usually start in one group of lymph nodes and spreads an orderly pattern, which is this is the most common in young adults. So this type of lymphoma also has a high cure rate, especially if detected early. So now I will explain about non-Hodgkin lymphoma. It's opposite from the Hodgkin lymphoma, which is does not have red stem cell and can arise from B cell or T cell. So it can spread in a less predictable way and more common than Hodgkin lymphoma, which is include many subtypes, can be slow, growing, or aggressive. So for the example of subtypes is B cell lymphoma, which is most common, and T cell lymphoma. So in short, Hodgkin lymphoma is specific cell plus more predictable spread. Meanwhile, non-Hodgkin lymphoma is many types and variable behavior. That's all for me. Now I will pass to my next teammates.
The most common symptom is painless lymph node enlargement, usually in the neck, axilla, or groin. Other symptoms include fever, night sweat, and weight loss, known as B symptom. Persistent fatigue, generalized itching, loss of appetite, cough or chest pain if mediastinal nodes involved, abdominal pain, or fullness due to splenomegaly or liver enlargement.
Now I will explain about the diagnosis of lymphoma. First, doctor will start with a physical examination, especially for checking swollen lymph nodes, which are usually painless. The most important test is a lymph node biopsy. This is a gold standard of confirmed lymphoma, where a sample of the lymph node is taken and examined in the laboratory. In addition, blood tests are done to assess the patient's overall condition, such as checking white blood cells and hemoglobin levels. Imaging tests like CT scan or PET scan are used to see how far the cancer has spread in the body. In some cases, a bone marrow biopsy is also performed to determine if the lymphoma has involved the bone marrow. In conclusion, diagnosing lymphoma requires a combination of tests to identify the type of stage of the disease. Next, I will explain the management of lymphoma. The treatment depends on the type of the stage of the disease. The main treatment is chemotherapy, which uses drugs to kill cancer cells. It is usually given in cycles. The next is radiotherapy. Radiotherapy may also be used, especially if the lymphoma is localized in a specific area. Next is immunotherapy. Immunotherapy helps to boost the body's immune system to fight cancer cells. and target therapy works by attacking specific cancer cells which may cause fewer side effects. In more severe or relapsed case, a stem cell transplant may be needed to replace damaged bone marrow. Lastly, palliative care is important to improve the patient's quality of life, including pain management and emotional support. In conclusion, lymphoma management involves a combination of treatment to achieve the best outcome for patients. That's all from me. Thank you. Bye.
Treatment of lymphoma is depend on the type, stage and condition of the patient. Number 1 is chemotherapy. Chemotherapy uses anti-cancer drug to destroy rapidly dividing lymphoma cell. It works throughout the body systemically, but it may also affect normal fast-growing cell. Number 2 is radiotherapy. Radiotherapy uses high-energy radiation to damage the DNA of cancer cells, preventing them from growing and dividing. It is usually targeted at specific affected area. Number 3 is immunotherapy. This treatment helps the immune system to recognize and attack lymphoma cells more specifically, such as through the use of monoclonal antibodies. Number 4 is stem cell transplant. High-dose chemotherapy is given to destroy cancer cells, followed by the infusion of healthy stem cells to restore normal bone marrow function. And lastly is close monitoring. In slow-growing lymphoma, treatment may be delayed while the patient is closely monitored until symptoms appear or worsen.
Hi, my name is Ainur Faria Humairah binti Ahmad Syukri. My number matric 24003001. One of the key positive effects of palliative care in lymphoma patient is effectiveness in improving quality of life by managing symptoms and providing holistic support. Number 1. Relief of physical symptoms. Reduce symptoms such as fatigue, shortness of breath, and nausea and vomiting after chemotherapy. Number 2. Improve quality of life. Help patients perform daily activity better. Also, reduce physical and emotional suffering. Number 3. Emotional and physiological support. Provide counseling for patients and family that can reduce anxiety, stress, and depression. Although palliative care has positive effect, it also has some negative effect on patient. Number 1. Emotional distress. Patient may feel hopeless when shift to palliative care that can increase their anxiety, fear, or depression. Number 2. Family conflict or misunderstanding. Difference in opinion about care decisions such as continued treatment or comfort care. And the last one, limited access to service. Not all patients have access to quality palliative care that can affect effectiveness of care. That's all for me. Thank you.
Hello everyone. Today I will present recent research, for example, related to palliative care in patients with lymphoma. Firstly, early palliative care improves quality of life. Early palliative care has been shown in recent studies to significantly improve the quality of life in lymphoma patients. It helps in better control of symptoms such as pain, fatigue, nausea, and support patients coping with treatment like chemotherapy and reduce treatment-related complications. For example, a study found the patient with lymphoma who received palliative care early reported a better overall quality of life compared to those who received it a later stage of the disease. Second, palliative care is often introduced too late. Another important finding from recent research is that palliative care is often started too late in lymphoma patients. Many patients experience severe symptoms such as extreme fatigue, pain, and breathlessness in early stage of the disease, but palliative care is only introduced near the end of life. concern, a study involved patients with hematological cancer showed that although patients had frequent hospital admission and a high symptom burden, palliative care was usually initiated only in the late stage, limited its effectiveness in symptom management. Third, palliative care reduces physical and emotional distress. Systematic review also highlight that palliative care plays an important role in reducing both physical and emotional distress. It not only manages physical symptoms, but also provides physical support. For example, patients receive palliative care reports lower levels of anxiety, depression, and emotional stress. They also feel more comfortable and emotionally stable compared to those who did not receive palliative support.
Hi! So, for the next point is, integration of palliative care with standard cancer treatment improves outcomes. Recent studies show that combining palliative care with active treatments like chemotherapy or radiotherapy leads to better overall outcomes. Patients not only have improved symptom control, but also better treatment adherence and sometimes even longer survival compared to those receiving standard treatment alone. The next point is, early palliative care reduces hospital admissions and healthcare costs. So, research has found that patients who receive early palliative care are less likely to have repeated hospital admissions or emergency visits. This is because symptoms are better managed early, preventing complications. It also helps reduce overall healthcare costs while improving patient comfort. The last point is, multidisciplinary palliative care improves holistic patient care. Recent studies highlight that palliative care involving a multidisciplinary team such as doctors, nurses, psychologists, and social workers provides more comprehensive care. This approach addresses not only physical symptoms but also social, emotional, and spiritual needs, leading to better patient and family satisfaction. That's all from me. Thank you.